Welcome to Prime Life. We call it Retirement 2.0. Leave each episode with tips and new ideas to help you navigate retirement in our new age. It's your time. Make it count.
This podcast is for educational purposes only. It is not intended as medical, investment, or financial advice. We do not sponsor or endorse any of the individuals, companies, products, or services featured on this podcast. Any statements or opinions expressed are of the individual who makes them. We hope you enjoy the episode.
Hi, this is Mary Crean, and welcome to another episode of the Prime Life podcast. I'm here with my illustrious co-hosts. Laura, how you doing today?
I'm doing well, Mary. I'm excited for our interview today.
I am as well. Joseph, how about you? How are you doing today?
Well, now that I've been called illustrious, my day just got a whole lot better.
If you would not mind introducing our guest.
Sure thing. It'd be my pleasure. So I'd like to welcome Brian Geyser, who is the Vice President of Health and Wellness for Maplewood Senior Living. He oversees memory care and lifestyle for the company and leads the Maplewood Center for Aging, Innovation, and Technology. Welcome to the show, Brian. Tell us a little bit about yourself.
Well, thanks, guys. Thanks for having me. Well, I'm a nurse practitioner by training. My background, my specialty is psychiatry. I've been in healthcare for about 30 plus years, which dates me a little bit, but I've been around the block in healthcare in every different facet, from emergency department to inpatient, outpatient, residential, home health. I've been on the insurance side, and I've been an entrepreneur. I'm a three-time entrepreneur. So in healthcare. So I've seen a lot and done a lot over my career. Most of my career has focused on older adults, but I did do and have specialized in the past pediatrics as well. So I sort of swung from one age group to the other end of the spectrum.
Why has the senior market or the senior group been something that you've moved toward? And I'm also interested to know about your background in psychiatry or psychology, how that's helped in the realm that you're in right now. Can you talk a little bit about that?
Yeah, so I was always drawn to vulnerable populations, I guess I would say. So young children and adolescents, and then those kids and adolescents who have mental health issues. We've seen now with the pandemic a big spotlight on mental health finally. But prior to that, mental health was a little bit in the shadows, and was not something that we tended to focus too much on when we spoke about healthcare in general. And I just saw throughout my time in school and my early days in my career that folks with mental health issues were not getting the attention that they needed and deserved. So, and I always gravitated toward either kids or older adults. I think there's a lot of similarities, especially as you get into the older old, where with pediatrics and geriatrics, lots of similarities in terms of the fact that you have not just the patient, but you have families involved. So with children, you have to interact with and kind of manage and deal with the parents, and with older old folks who are dealing with their adult children often or their grandchildren. But I feel like those two populations need kind, compassionate, caring individuals to be a voice for them. And they're also complicated. It's actually a lot easier to just treat adults our age. We're a little less complicated than kids and frail older adults whose metabolism is different, biology is different, and they often have multiple conflicting chronic conditions, which makes it very challenging to care for them.
Brian, I'm really interested in learning a little bit more about what you're doing in the aging, innovation, and technology part of your job, specifically because you just mentioned a bunch of different demographics, right? And older demographics are sort of stereotyped as to not being, tech savvy, but the younger generations are. So tell me what you guys are doing in that space? What's the most innovative thing you guys have worked on?
Yeah, so when you're dealing with the population that we serve is average age about 85 years old. I'll step back for a second and just sort of explain. Right now I'm in the senior living industry, and senior living is kind of broad, and it's important to understand the context of senior living. It starts at about age 55, and you have the 55 and older active adult communities. And those are communities designed specifically for the younger, older folks. I'm right there in that age range where, I might be looking at a community, active adult. And there's a lot of innovation around that population. And the one that comes to mind specifically is Jimmy Buffett. Jimmy Buffett created the Latitude Margaritaville communities with that population in mind. So the active 55 to 65-year-old adult who likes and demands a certain kind of lifestyle, party atmosphere, lots of music, lots of beach and drinks and things like that. And Jimmy Buffett had that kind of sewn up. So what he brilliantly decided to do is create a business model out of that, create these communities around the country that focused on that lifestyle and that population. When you get a little bit older than that, you move into what's called independent living. This is folks who move into communities where they're still independent, and they don't really need many or any services, but they know at some point here relatively soon that they will. And often independent living communities either live on a campus, you sit on a campus that has other more advanced assisted services available and healthcare services, or they live in close proximity to those places. And then the next part on the spectrum would be assisted living. So that's for folks who are yet a little older and they need more assistance, more healthcare. Usually within assisted living communities, you have a memory care component. That's for folks who get some form of dementia or another and need special sort of care. And then you have skilled nursing facility, which is beyond that, which is more intensive medical component to it. So that's kind of the general spectrum of senior living. And there's innovation happening in all facets of senior living. Margaritaville being one non-technology innovation, if you will. It's more lifestyle and service and hospitality focused. The technology innovation that we're doing is really leveraging emerging technologies that will help us to ensure that our residents that live in our communities are safer, happier, healthier. Those are kind of the three main buckets. And our staff are able to use those technologies to ensure that those three things are happening: safety, happiness, health, and wellness. So one of the things that's exciting now in the senior living space is the leveraging of advanced sensor systems and artificial intelligence to analyze the data that's coming in using those sensors. We all know that there's labor shortages everywhere, and senior living is not immune to that. So we've tried to figure out ways to leverage computer vision, sensor systems, machine learning, et cetera, to help us understand what's going on with our residents, so that we can better resource our staff in different places in our buildings. So right now we are piloting a advanced machine vision system that we're using inside the apartments of our most vulnerable residents, and that's mostly memory care, but also residents who are cognitively intact but have a lot of care intensity, lots of high care needs, or might be at risk for adverse events like falls at certain times of the day or night. So what these sensors do is it basically turns the apartment into an extended member of the care team. And the machine vision is constantly observing what's going on inside the apartment. That's done in a privacy protected, HIPAA compliant way. And as the machine is kind of observing the behavior, it's learning about the resident. It's learning the resident's typical patterns and behaviors. It's also monitoring our staff behavior. So it knows when a nurse's aide comes into the apartment, who that nurse's aide is, how long they're spending in there, what time of the day that's happening, or whether it's a nurse or some other caregiver or a family member. And so that data is constantly being captured and then crunched by the system. And what that does is it spits out, important information that's actionable on the operator's side. So it's telling me, for example, that this particular floor in our community is a very high intensity floor in terms of care. And then we can say, okay, well, we probably need to resource that floor a little bit more than we're resourcing the others. But then we can dig in deeper and we can see why that's happening. We can understand, oh, well, it's these two residents that we're spending an awful lot of caregiver time and a lot of our nursing time. And then we can dig further and understand what that's about. So it's really going from high level drilling down into individual resident behavior. That also helps us figure out what kind of care levels that our residents should be at, which in turn creates revenue for us. So and that revenue helps us offset the cost of providing the care. So having this this new assistant, if you will, helping us figure all that out passively, serving us up this information is really, really critical on the operator side. From a safety perspective, it's fantastic because if you think about residents who have dementia, especially when they're in the middle or later stages and they're very confused, they might be disoriented, not sure if it's day or night, and they might have trouble with spatial orientation. They're very high fall risk. Prior to these new technologies emerging, we had no visibility inside the resident's private apartment. And in part because we're also concerned about privacy issues. But when you talk about residents like this who are extremely vulnerable and are very high risk for safety issues and catastrophic events, we've now got a way to both protect privacy and monitor a resident's behavior in a way that's proactive. So the cool thing about this system is it allows for total privacy. There's no intrusion. The system sits quietly up in the corner of the apartment, and it just kind of monitors what's going on. And at 2 o'clock in the morning, if a resident is starting to rustle around and get a little restless, it detects that that's happening and knows that when this happens with this resident, in about 5 minutes or less, they're going to get up out of bed and go to the bathroom. And then so what it does is it proactively notifies us that this is happening before the resident even exits the bed. Then our staff get a notification right on their mobile device. And it's not just a notification, but it's a contextual notification, meaning it sends an instant real-time video clip of what's going on inside the apartment, again, protected and HIPAA compliant. But I can now see what's happening inside the resident's apartment right on my device. And as a caregiver who has maybe 5 or 7 or 9 other residents that I'm also responsible for, I can then determine what do I need to do with this information. So I can prioritize a response, and I can say, well, in this case, I know that this resident is safe to get up on their own, but I do want to keep an eye on them virtually or from a distance. Or I can say, this resident is very high fall risk, and I'm going to go and I'm going to attend to them right now before they even get out of bed. I'm going to assist them to the bathroom and assist them back to bed, get them tucked in, and make sure that they're asleep. And then I can go on and do the rest of my stuff. So in having that capability, what we're seeing is we're literally intervening thousands of times a month on our residents in a proactive way and potentially heading off catastrophic incidents like falls. Now, when an 85 or a 90-year-old person with dementia falls in their apartment by themselves, it can be completely catastrophic and in some cases fatal. And part of the reason is because it's often dark. They may trip, they may hit a corner of a table or something like that, have a head strike. But then they're on the floor and they often don't have the ability to call for help. All of our residents wear pendants they can press if they need help. Person with dementia doesn't even remember they have that on them. And they might be hurt to the point where they can't call out for help verbally. So this system not only helps us prevent that kind of a thing, but if it does happen, it also sees that happening and it notifies us with a different kind of notification. And our response times on floor events or falls like that have dropped dramatically. So we're talking about, 1 to 2 minutes we're in the apartment after a fall in most cases. And that can mean life or death in some circumstances. So it's really exciting stuff.
Yeah, that's amazing, and it's so great to hear. I would think that the family members have excitement and trust and security in the fact that residents are there with you with this type of systems in place, and kudos, because I can't imagine a situation that if it were to occur and care was not be able to be provided in such a timely manner. So I think that's amazing. So shifting gears slightly, talk to us a little bit about Aging 2.0. So I read a bit about it here in the write-up that you shared with us, but I want to learn more and talk to us about the community aspect, because you deal with community with the work that you do, and that defined as a community, but it seems as though there's a community behind Aging 2.0 as well.
And we'll get that answer after a brief word from our commercial sponsors.
Nassau is always working harder to be your carrier of choice. We offer insurance products that can help you meet your retirement goals, such as protecting your savings, securing lifetime income, or paying for healthcare costs. We're dedicated to providing best-in-class service and are keeping things simple, and we'll have your back. We have around 400,000 policyholders and contract holders and have been doing this for a long time, 170 years. But we remain humble enough to always try to improve. For more information, visit nfg.com. Nassau insurance products are issued by Nassau Life and Annuity Company of Hartford, Connecticut, Nassau Life Insurance Company, East Greenbush, New York, or Nassau Life Insurance Company of Kansas, Overland Park, Kansas. Subsidiaries of Nassau Financial Group. Products are not available in all areas. Policyholder counts are for all Nassau companies as of September 30th, 2022, and are subject to change.
Coverite is the first digital concierge health insurance platform focused on Medicare. Their mission is to make Medicare more transparent and accessible for America's 60 million Medicare beneficiaries. By simplifying a traditionally confusing and complex decision, Coverite delivers a simple, seamless, and hassle-free plan selection and enrollment experience. Try the Coverite platform and see for yourself why they've been referred to as the TurboTax for Medicare. Visit coverite.com/podcast to learn more.
Yeah, so Aging 2.0 is a global network of, I guess you'd call it, aging innovators. So these are folks who recognize that aging is something that we all need to be paying attention to, not only because we're all aging ourselves, but because our parents are, and it's happening in greater and greater numbers. So we have this phenomenon where every day, 10,000 people are turning 65 or older, and what that is going to do eventually, from a population perspective, is we're going to have a massive number of older adults who need care and who need attention and who need services and who need technology to help them. So Aging 2.0 was born out of this idea that this is something that's a global phenomenon, and that we all need to come together to figure out new and better ways to take care of our older adults. And so what Aging 2.0 does is it seeks out innovation all over the world, and it allows innovators and emerging companies to do pitch events and so forth, get funding, and then ultimately scale their organizations up so that they can help the world be a better place, and also, as a capitalistic society, make money in the process. But the community of Aging 2.0 is really interesting because it's organized around chapters. So individuals like myself can start a chapter in a city near us. So I started the New Haven, Connecticut chapter. And then Aging 2.0, the organization, gives us resources to help us be successful, bringing together other innovators in our local area. We have pitch events and networking events and so forth. And then we share all of our learnings across the network, across the world. We get together with chapter leaders from all over the globe and share ideas, collaborate, communicate, and it's just a really nice global community.
So I'm curious about how your caregivers and your employees, how have they received the technology improvements or advancements? Like without giving names, I don't know if you can even share a very short story of an employee that really understands and sees the benefits of the technology that you were referring to. Because I think, like Laura and Joseph, I think it's amazing. And I know if I were a caregiver, at one of your facilities, I would be grateful for that, because it would help me quite a bit. But I'm just curious about that.
Yeah. Well, what's interesting is we're seeing more and more families who are touring our facilities are interested in the types of technologies that we've implemented, and it's almost like they're kind of coming to expect. Do you have Alexa, and how do you use mobile devices, and do you have any sensor systems and things like that? So it's becoming a thing. The other thing that's interesting is with this system that I'm talking about, the machine vision system. One of the things we didn't know was, would families adopt this technology, because it's in our case it's completely voluntary. We're not forcing this on anyone. We're saying we have this great technology. There are privacy issues, but we've protected that in these different ways. And if you want to opt in, you can. We've had about a 98% opt-in rate, which is unbelievable. And that speaks volumes, because what I think it's saying is people are more interested in safety than they are privacy when it gets to a certain point in their life. And I think, if the analog a little bit is all the social media that we all do, right? We give up our privacy on Facebook to get all the benefits of being connected to our family and friends. But as you get older and older, safety becomes more important than other things you would think about. The other thing I want to mention about that is we also worried that our attorneys would balk at having, sensors and cameras in the apartments. And as it turns out, they're extremely happy about this technology. They love it. And the reason is because they now have the truth, right? So good, bad, or indifferent, good, bad, or ugly, they've got the truth. They don't have to worry about 10 different people telling them 10 different things about what happened in the apartment. Augie, the system we use, doesn't lie. It's always on. It doesn't need overtime, and it just tells the truth. And it's a lot like the police dash cams. At first, police departments were like, no, we're not doing that. Cops were not interested in having cameras, but now they're everywhere and everyone uses them, of course. And most of the time, it does protect the officers and it protects the police departments themselves. You're always going to have a bad apple here and there, and it captures that too. But that was interesting. So, I think we're really excited about offering these different types of technologies. People are becoming to expect it, and they're asking for it. It's becoming a competitive advantage to have these things. So, yeah.
I have a couple of follow-up questions. I'm going to try to cram them all into one. Some are quick answers, probably. So technology, can solve problems. It could also create problems. You mentioned earlier 1 to 2 minutes for staff to show up to a room. I'm curious, and this might be the longest part of the questions, what has been the impact on falls across the enterprise? Have you seen a significant decline? So that was one question, follow up to the earlier conversation. Second, was this technology you guys built, or you went out and brought in some third-party technology? And then the fourth, what was the staff's response to this technology? So I crammed it all in because I know we're going to run out of time.
Yeah, so we'll take the last one first. The staff have loved this technology. They've adopted it across the board. And now they say things like, I could never do my job without this because I can't be in 5 places at once. So now they can take a look on their mobile device. They can check on the residents anytime, 24/7, make sure that they're safe. And then I also can prioritize their care tasks and duties. They can look at 7 in the morning. I get in for my shift. I look on my system. I can see 3 of my 5 residents are in bed sleeping still. The other 2 are awake. I'm going to go to them first, and I'm not going to go disrupt them. Yep. So that was so we've got a lot, and with this particular technology, it's a very high adoption. That's not the same with all the tech that we use. We've had many fails as well on that front. What was the other question you had? You said there's 3. I forgot the other 2.
Yeah, build it versus
Oh,
third party,
yeah.
and then the
So
third was the fall, and
okay, yeah.
compatible.
So the build versus buy. So we ha- I sort of happened along this technology, an emerging startup company that was born out of the hospital systems in New York City. A bunch of very smart nurses developed this for the acute care space in hospitals. I met them one day in New York City at our building just by happenstance, and this relationship was born. We started to work closely with them. I wanted that same technology in senior living. We didn't have anything like it, and so we I wouldn't say we built it, they built it, and then we sort of co-developed the senior living version of it with this company. And now, interestingly, they've decided to pivot away from hospitals altogether and move completely into senior living because they see the value and the massive opportunity to help people. Falls have dramatically reduced. We have unacceptable number of falls happen in people's homes, but also in senior living. And one of the advantages to moving into senior living, of the many that there are, is that it's generally a safer place to live if you're an older adult. And there's many reasons for that, but now this technology is one of those reasons. The falls have dramatically decreased. When we did our initial pilot, we had 33 residents in the initial pilot with this, all of them very high fall risk. And over the 3-month period of studying this with the Augie system in place, we had 2 falls. Now that's just unheard of in a population like this. We have thousands of falls a year, and it's really bad. And so, and again, it's because of the nature of the population. They're on multiple medications, they're frailer, they're unsteady on their feet when they rise out of a chair. There's so many reasons why this happens, but this has dramatically reduced the number of falls we're seeing.
That's amazing. So, is there something, if you could just pull out, some magic dust and say, poof, I've created this innovation. Is there something that you would create today if you could to help solve for something or to increase safety, increase comfort, increase happiness, increase connectivity, whatever it is? Is there an innovation waiting to happen that you have tucked away in your mind that you wouldn't mind sharing? That isn't out there yet for this community?
Now, an ad from one of our sponsors. Remember when you could trust the news? Well, then check out Walter. Walter is the free, no-nonsense newsletter for grown-ups that comes to your inbox 3 times a week. From current trends, aging in place, travel, retirement, and everything in between, including a dash of pop culture trivia and throwbacks, Walter is a great way to start your mornings and to stay informed. Oh, and did we mention that it's free? Check us out at thisiswalter.com. Get smart. Get Walter.
Yeah, I think it's, to be honest, I think it's people don't like when I say this, but it's robotics. I think that having robotic caregivers is something that we have to see and we have to embrace the idea of. And if you think of think Star Wars, you think C-3PO or R2-D2, these things are not impossible now. We have them now. Now the key is to translate that into something that would be a caregiver for an elderly person at home. So I think with advanced machine robotics, and then you mix that with some of these LLMs that are coming out, like ChatGPT, and you combine all of that, and you work on it for a year or two. I think we now have the recipe for something that's really special. We simply just don't have the workforce to be able to care for this older population. And if you can build robots that are empathic, that are thoughtful, that are compassionate, and that can do some of the basic tasks that a human can do, not replacing humans. I'm not suggesting we do that, but really augmenting what humans can do, enhancing the human relationships, making it easier to connect with friends and family via the robots. We're using robots right now, just as an example, to do what we call robot assisted geriatric consults with the Cleveland Clinic. So we have the chief of geriatrics at the Cleveland Clinic literally controlling a robot from their office at the clinic and driving it right down the hallway of one of our communities. And you could see the doctor on the face of the robot. And she drives it right into a resident's apartment. And while there, she can assess the resident. She can look up and down, left and right. She can look around the apartment and see how things are going in the living environment. Can get a full set of vitals, and then can do a cognitive screening and a full assessment on that resident, and do it all via the comfort of her office, never having to leave the office and waste time on the road and traffic and all these things. And so in that sense, we've combined a machine with a human, and we've brought world-class geriatric care into our community, that's an hour away. And it's all real time, and that's a perfect example of like the human machine interface.
So of course my mind is going to Joseph. I'm looking at you, Rosie from the Jetsons. I'm sure you had that twinkle in your eye. But as we come to a close, Joseph, do you have any last thoughts?
You said it perfectly. I was 100% thinking about the Jetsons, and I was like, the future is here. The future is now. I'm all in. So sign me up. I'm good. I asked a whole bunch in my last round. So thank you.
And so, Laura, as we prepare for your special final question, please go for it.
Sure. I should switch it up and ask something completely different than usual, but that wouldn't be fun. And I too saw Joseph, the robot twinkle in his eye as soon as Brian started to speak. It's like, oh, here comes Rosie. So Joseph has a special place in his heart, or Rosie the robot from the Jetsons from a previous episode.
Our robot looks a lot like Rosie.
See? I think everybody has that nostalgia component. So Brian, we like to ask this question of our guests because we've learned a lot about you in the last 20 or so minutes that we've been speaking, and we've read about you in advance and we've prepped our conversation, but there's nothing like understanding what is your why. You can wake up every morning and do anything, and you've done several things that are quite impressive. We'll put links to those in the show notes. But what is your why? Why do you do the work that you do?
Well, my why is I believe that we can do better taking care of our elders who, without them, we wouldn't be here. And without their sacrifices, this world would be a different place. And so I feel we owe it to them to do right by them. And I know that one day I'll be there too, and we all will. And so I hope that when I'm there, there's people like us to be able to care for us and give us the lifestyle that we deserve.
That's wonderful. So Brian, as we come to a close, we want to thank you for joining us today. And is there any particular way, if folks are interested in learning more about you, your innovations, or your facilities, how they can best contact you?
Well, you can always call us at Maplewood Senior Living. Look it up on Google. You could Google my name and you'll find all kinds of stuff, I'm sure, on there. Hopefully all good. And you can reach out that way. I'm all over, social, LinkedIn. LinkedIn's probably the best way, actually, now that I think about it. So just look me up on LinkedIn and hit me up on a private message.
Well, thank you, Joseph, Laura. Thank you for joining us here today. And we'll see everyone next time on another episode of the Prime Life Podcast. Feel free to follow us, to like us, to give us feedback. Thank you, everyone.
Thank you, guys. Thanks for having me.
Remember to subscribe to the Prime Life Podcast anywhere you find podcasts. You can find all of our episodes, contact information, and more on our website, primelifepodcast.com. Stay connected with us. Follow us on LinkedIn, Instagram, Facebook, and TikTok.